Mr. President, there are several important domestic and international matters before us that require our urgent attention, not least of which is the need to find a bipartisan path to keep the federal government open and funded within the next 3 days to prevent a national economic calamity. We have a lot of work to do. A lot of priorities vie for our attention. But today, on World Diabetes Day, I rise to address another pressing issue that I believe also requires our timely action. Mr. Chair, I want to uplift the findings of my new bipartisan white paper released today on this World Diabetes Day. It shines a light on the urgent need for Congress to finally address the high costs of insulin and pass federal legislation to cap the cost of insulin for every American who needs it. This report is issued jointly today from my office in collaboration with my partner in this work, my friend, the Republican Senator from Louisiana, John Kennedy. Senator Kennedy and I have been working to address the high cost of insulin because this is a problem that is particularly acute in our states. Over 12% of adults in my home state of Georgia, 12%, are diabetic. But in Louisiana, that number climbs to over 14%. And many of these are people who cannot afford access to this life-saving drug. This is what we hear from the people in our states, but this new report, for the first time, takes a comprehensive look to learn more about who and where these people are. And what we found in our original analysis is that there are more than 800 counties across the country where you see the tragic convergence of high rates of diabetics coupled with high rates of uninsured people. High levels of diabetes, high levels of uninsured people. And we call these insulin deserts. These insulin deserts, some 813 counties across our country, are in the top half of counties across the country for both their percentage of individuals who are uninsured and who have diabetes. Over 800 counties. And over 100 of these insulin desert counties are in my home state of Georgia. Over 75 million non-elderly people live in insulin deserts. That includes more than 12 million Americans who are uninsured. In fact, among non-elderly individuals, insulin deserts have nearly double the percentage of uninsured residents as those who live in non-deserts. And so our analysis shows these insulin deserts are concentrated in the South and the Southeast. But it also shows that there are insulin deserts all over the country, concentrated in the South and in the Southeast, but you see them from Washington State to Texas, to North Dakota, to Florida, to New Jersey. In other words, this is a national problem. And who are the people in these insulin deserts? Well, as compared to uninsured folks in other parts of the country, uninsured Americans who live in these places are, one, more likely to fall under the federal poverty line than their counterparts. They are less likely to be college graduates than uninsured Americans in non-deserts. They are more likely to be people of color than uninsured Americans in non-deserts. In fact, in 2019, Black Americans were twice as likely as non-Hispanic white Americans to die from diabetes, and uninsured Americans in insulin deserts are less likely to have access to sufficient internet service than uninsured Americans. And why does this matter? It matters in part, one of the reasons it matters is because it means that they have less access to patient assistance programs offered online by insulin manufacturers. And we know that the challenges that uninsured people experience when it comes to accessing health care. This report deals with the uninsured, people who are diabetics, and the convergence of those two things. And so, Mr. Chair, what does all of this mean? What this report illustrates is that even with the steps private industry has taken to lower insulin costs, steps that are good, that many of us in Congress pressed them to do, but are still voluntary, and by the way, they could be rescinded at any time. And even with the steps more than 20 states have taken to institute state-level insulin copay caps, and even with our success in lowering out-of-pocket insulin costs for Medicare beneficiaries, there are still millions of Americans in communities across our country who are being left behind. They live in these insulin deserts concentrated in the South and the Southeast, but you see them all over the country. And they are being left behind. According to the Department of Health and Human Services, in 2019, uninsured people with diabetes spent close to $1,000 on insulin alone. If you're poor and you're uninsured, that number is unaffordable. We know that number includes the 246,000 uninsured Americans who use insulin every year. And we know that number rises to more than 540,000 Americans when we include those who experience a lapse in coverage. But even when we look past the uninsured, we know that when we include those Americans with private insurance, the total number of Americans who are left vulnerable to potential spikes in insulin prices jumps to some 2.75 million Americans. Here's the thing, insulin should not be expensive. It's a 100-year-old drug. When it was invented, the patent was sold for $1. It certainly shouldn't be unaffordable. For the first time, this analysis, which my office releases today, paints a clear picture of who is needlessly suffering and who we will leave behind if we do not pass my $35 cap for the insured and the uninsured. We already know what happens when people can't afford their insulin. We know that 1 in 4 diabetics, ration their insulin. In the United States of America, people are rationing insulin, getting insulin from friends who have relatives who passed away. I spent time with a young woman in my state named Lacey, who as a graduate student was meeting people on Facebook meetup groups and then meeting them in dimly lit parking lots at the local Chick-fil-A to get insulin. In the United States of America, a drug invented 100 years ago, sold for $1. That's not right. But not only is it not right, it's not smart. It's bad fiscal policy. We know that every year federal and state governments spending on hospitalizations related to complications from diabetes totals more than $11 billion. That's more money than it would cost to cap the cost of insulin for everybody who knows it, for everybody who needs it. And so, yes, I'm a pastor. I'm going to make the moral argument, but I'm saying to you that it's not right and it's not smart. And perhaps that's why there are many of my colleagues on both sides of the aisle who care about this issue and have long been working to make insulin more affordable for diabetics. I want to commend my colleagues, Senator Jean Shaheen and Susan Collins, for their leadership over the years that has helped keep this issue on Washington's front burner. I look forward to our continued partnership in the coming months on this issue. Mr. Chair, I was proud that last year this chamber passed a provision from my legislation, the Affordable Insulin Now Act, that was signed into law as part of the Inflation Reduction Act. Since January 1st, that provision has been saving our seniors money by capping out-of-pocket insulin costs at no more than $35 a month for Medicare patients. And Mr. Chair, my original Affordable Insulin Now Act included a $35 a month insulin copay cap for patients on private insurance as well, and it almost passed this chamber. We got close. Now it's time to get it done. We weren't successful in getting that provision over the finish line, but I was proud that earlier this year, I got together with my friend John Kennedy, and we introduced a new bipartisan version of the Affordable Insulin Now Act that would finish the work we started by capping insulin costs at $35 a month for insured Americans and uninsured Americans. Since then, Senator Kennedy and I have been working to build support for our legislation, which we've committed will be, listen, completely paid for. And I'm proud that support for our plan has continued to grow. I'm proud our bipartisan bill has the support now of a broad coalition of senators from both sides of the aisle, from Senators Fetterman to Peters to Hawley to Vance to Warren to Casey to Britt to Tuberville to Braun to Rosen. Senators who don't agree on a whole range of things. But we all know this makes sense. Our bipartisan plan to lower insulin costs for the insured and uninsured also has the support of organizations like the American Diabetes Association, the American College of Physicians, Protect Our Care, and First Focus Campaign for Children. So on World Diabetes Day, I encourage all of my colleagues to read this report, which we released today, because it drives home the work we should be focused on for the more than 7 million Americans with diabetes who use insulin. And it reminds us of who we leave behind when we fail to act. Dr. King said, of all the injustices, inequality in health care is the most shocking and the most inhumane. Shame on us if we can't get this done. And so, in closing, and nobody believes the Baptist preacher when he says in closing, I think that this report is summed up by the story of a woman in the state of Georgia. She said, I have suffered with diabetes since the age of 11. The type of insulin that cost me hundreds of dollars every month at the pharmacy was released to market the year before I was diagnosed. She said, I bought a vial in 1997 without insurance, and it cost me $18 in 1997. This insulin has not changed since then. The drug hasn't changed, but it now costs hundreds of dollars. Something needs to be done to ensure we who depend on this life-sustaining medicine can continue to afford it. We will literally die in a matter of days without it. It is not a matter of choice. I agree with her. Something must be done. And so let me just thank folks in my office, dedicated public servants who've been working on this issue, especially Gabby Vesey, Annie Wong, and Harper Melnick, for their work on this report. Thank you. People who need insulin really need it. It's not a matter of choice, and Congress can make a difference by passing this bipartisan legislation. I urge my colleagues, with all that we have to do, to prioritize this work as we handle the host of other vital issues that requires this body's attention. Thank you, Mr. Chair, and with that, I yield the floor.